So this next presentation is by our team, Sarah Hughes, May Ree, Gabriella Ashes, Kate Panzer, Kelly Wise, Heidi Joshi, and the title for this presentation is Incorporating American Sign Language Education into Medical Training. And this was actually part of our ongoing medical elective that we offer here at University of Michigan Medical School. Okay, next slide, please. So we're going to just kind of briefly cover a few things, give a little context on this, how this actually got set up. And for the first time, really did a robust evaluation just to learn on the impact of this course on medical students, especially preparing for how they can care, communicate, and work with deaf and hard of hearing individuals. And then we're going to just talk a little bit about their feedback and talk about next steps. And next slide. So I just want to provide a little bit more context. So while this was a American Sign Language course, it was not just for deaf signers, but deaf signers is a really disadvantaged patient population in our healthcare setting. And that's because of communication and language barriers that we often see. And it's a little challenging to get the exact size of this population because there's actually one language that's not captured in the US Census. And this has unfortunately made it very difficult to really get a size estimate of the patient population. But we have sort of rough estimates, and we expect that it's somewhere in that ballpark of about 500,000 to a little bit more individuals who identify as being deaf American Sign Language users. There are very few medical schools that actually do provide any formal ASL or deaf health education. And this has unfortunately made our clinicians ill prepared to care for individuals who need language and communication access. And then lastly, there's a great need for culturally, linguistically accessible training in the medical school curriculum. And next slide, please. So what we did in 2021, we actually set up nearly 5 years ago this Medical American Sign Language elective. And this is a one credit elective that's available typically for first year medical students. We sometimes have other years that join when their schedule allows. And the goal for this 10-week elective is really to combine opportunities to learn from a deaf individual with language instruction, but more importantly, to learn about what does it mean when we talk about deaf culture? What are some of the medical legal responsibilities that we should know about? And how to, for example, set up arrange interpreters, how to make the visit more accessible. And these weekly 90-minute sessions, most of them were only in ASL, only policy, and that is really just a challenge and get them more comfortable with ASL. And we also offer patient panels, simulations, and talked about different ways to make things more accessible, including assistive devices too. And next slide. So in our last year's course, when we gathered these surveys, we did a pre and post course evaluation, and we had 28 medical students that actually participated. 96% of these were actually the M1s. We had another student that was an M4. We also had 64% of our survey respondents were actually females, and 14% self-reported disability. I know we had an earlier presentation that it was about that 9%. So we were slightly higher than that. And then 82% had no ASL experience. So this was really their first time doing something like this. And next slide. So with this pre and post course surveys, what we really want to do is really learn about the changes or the impact on students' knowledge, attitudes, and their self-reported competencies with various different topics that we had. So we wanted to get them to understand some of the barriers that exist, their confidence level in arranging an ASL interpreter, and also their knowledge of disability laws and comfort interacting with these individuals. We wanted to get a better understanding of their perceptions of healthcare accessibility and preparations, and feeling prepared to care for these individuals. These were questions, we had some demographic questions, but we also had others that really assessed these competencies, and they were using 4 or 5 point Likert scales. Due to the smaller size, we just did descriptive statistics and pair t-tests to evaluate the change. And next slide. So there's a lot in this slide, but I'm just going to kind of give you a sense of some of the changes here. That was basically from a Likert scale. So we have pre-course and post-course. The next slide I'm going to show you, that'll kind of give you a little more information on some of the more relevant things. But this was really, again, was on topic based. So being familiar with deaf and hard of hearing barriers, confidence level in terms of arranging interpreter services, knowledge of disability laws, comfort interacting with these individuals, and also confidence in equitable care. And then the other 3 were perceptions of healthcare accessibility at the institution. So we wanted to get a sense from how they felt we were doing here, and then support for including ASL, deaf health in curriculum, and then preparation for caring for these individuals. So let's go to the next slide. So what we found is that among some of these topics, there was a significant change. And so we had a support from ASL education that actually went up nearly 20%. There was already a fair amount of individuals that felt already had good positive feedback and recommended to have these courses be part of it. So there was a little bit of a saturation with that one. But comfort with deaf, hard of hearing patients, many of them did not feel they were well prepared. So this was actually a pretty notable gain. And we had about 40% increase in terms of comfort to be able to care for these people. And then the other one is arranging interpreters in the future. There was a really sizable gain, over 60% increase in terms of the interpreter arrangement confidence. And then the other one, nearly 60% increase in terms of their improvement with disability law knowledge. And then lastly, deaf, hard of hearing barrier awareness improved roughly about 50%. So let's go to the next one. So some general feedback. So students overall really enjoyed the course. This was actually a pretty engaging course for students. Many of them really also enjoy connecting with deaf and hard of hearing patient panelists. There were opportunities to engage also directly to kind of practice their skills and get a better understanding of these different healthcare barriers and what does it mean to arrange interpreters. So there was just a lot of great opportunities for them. The course was really perceived as being very impactful and relevant for clinical skills. And so many of them were really helpful that they got some sense of what to do. And it was really designed to be practical, help them in a clinical setting. And then lastly, of course, with the very limited 10-week window with 90 minutes at a time, there was just not enough time to cover all topics. So the topics that they wanted was more shadowing opportunities and further overview on complex communication and some of the ethical issues like cochlear implantation, how to kind of navigate when there's other situations like Deaf Plus. So those are other topics that we were not able to accommodate. Okay, next slide. So in terms of further next steps, the ASL education really does give them an opportunity to learn a little bit outside of the typical curricula and also gives them some basic language skills. So in case if there's an emergency while in preparation for an interpreter being arranged, there's an opportunity for them to be able to engage and provide some communication access. And then the short courses still was impactful. So even though it was limited in 10 weeks, we were able to see measurable gains in several topics. And sort of where we're going, we're hoping to have longitudinal follow-ups. So longitudinal clerkship sometimes can be combined with other types of disability topics. And then doing more objective skill testing is an area that they would like as well. And then obviously there's times outside that we probably can do that's going to be more related to presentations. So whether it's with the medical students for disability, health, and advocacy that could talk about accessibility and some of those other challenging ethical topics. And next slide. So I want to thank everybody, especially the deaf community that supported this course, and also our students who participated, and also for our team as well. And more excitingly, we have our paper in press as well. Thank you so much.